I'm Alice. Welcome back to Men Health 30, where we don't shy away from the truths about men's health, especially sexual health. If you're a man over 50 and one day you suddenly notice blood in your semen, you might panic. But then, you stay silent. You don't tell anyone. You don't see a doctor. And you try to reassure yourself. Maybe it's just age. It'll go away in a few days. Let me be direct. That could be the mistake that costs you both your sexual health and your life. According to urological studies, blood in semen, medically known as hematospermia, is not a normal sign of aging. It may be an early warning of chronic prostatitis, infection of the seminal vesicles, or even early-stage prostate cancer, all of which can occur without pain. Don't click away from this video, because in just the next few minutes, I'll tell you. White heavy checkmark: when is hematospermia considered harmless? White heavy checkmark: when is it a red flag you should not ignore? White heavy checkmark: and what are the 3 actions you must take immediately if you've ever experienced it, even once? You might call it a little unusual, but in medical terms, it has a very clear name: hematospermia, or blood in semen. Here's what you need to know immediately. This is not blood in the urine. It is blood appearing specifically in the semen. You may notice semen turning pink, bright red, or rusty brown. Fine thread-like streaks of blood, or scattered red spots, mixed into the fluid. And if you're over 50, you should pay closer attention to this than almost anything else today. Pushpin: according to the National Institutes of Health, NIH, 2021. Blood in semen should never be considered normal, especially after age 50, when the risk of prostate-related conditions increases significantly and silently. Why is it particularly important after 50? Because at this age, the tissue structure of the prostate and seminal vesicles begins to degenerate, making small blood vessels more fragile and more prone to inflammation. Even a mild infection can lead to internal bleeding, silent and painless. Warning: not feeling pain doesn't mean there's no problem. In fact, in many cases, blood in semen is the first sign of chronic prostatitis, seminal vesicle infections, cysts, or even early-stage prostate cancer. The real issue is this: most men ignore it. They don't tell their doctor, or they feel embarrassed and let the condition go unchecked for months. Barchard, a study published in the Urology Journal, 2020, found over 70% of men over 50 who experienced hematospermia delayed seeking medical evaluation for 2 to 6 months. Among them, nearly 30% were later diagnosed with treatable prostate abnormalities. So if you've ever seen blood in your semen, even once, don't ignore it. It may be the first silent alarm your body is trying to send you. What causes many men to be complacent is the belief: I'm not sick. I eat well, urinate normally. Maybe it's just a burst vessel or something small. But the truth is, you don't need to have a disease to experience blood in your semen. You don't need trauma. You don't need surgery. All it takes is masturbating too hard, too long, or too frequently, and you could cause micro-injuries within your own reproductive system. From a medical perspective, the mechanism is clear. Every time you masturbate, your perineum, the area between the anus and the scrotum, endures mechanical pressure. This region contains several vital structures: the prostate gland, seminal vesicles, ejaculatory ducts, and posterior urethra. When stimulation is repeated or forceful, especially after the age of 50, when capillaries are more fragile, tiny blood vessels, microcapillaries, are more likely to rupture. The result? Blood leaks into the semen. No pain, no fever, but the biological damage is real. And it gets more serious if you already have mild, asymptomatic inflammation in the prostate or seminal vesicles, benign prostatic hyperplasia, BPH, causing semen congestion, or poor hygiene after masturbation, leading to irritation or low-grade infection. Backhand index pointing right, these factors compound and result in hematospermia. Books according to the Journal of Sexual Medicine, 2018. Up to 28% of hematospermia cases without clear physical abnormalities were associated with excessive or aggressive masturbation. Hourglass not done, and once those microvesicles are ruptured, this condition can recur over and over again, leaving you worried, yet still unsure of the cause. This is not a reason to panic, but it is absolutely not something to ignore. Because if repeated without proper management, these small injuries can evolve into chronic inflammation, silently damaging your prostate and sexual function over time. I must emphasize this once again. Not every case of blood in semen means cancer. In many situations, it's simply caused by minor ruptures in delicate blood vessels, something that can heal on its own. However, if you're over 50 and begin noticing the following signs, this is no longer something to wait on or monitor passively at home. First, if the bleeding persists for more than 2 weeks without any known trauma or impact, there's a high chance this reflects deep tissue damage or an underlying condition. Second, if you experience painful urination, frequent urination, or urinary urgency, this could indicate prostatitis or seminal vesicle inflammation, both of which require proper treatment. Third, if you feel pain during ejaculation, that's a clear sign of deep inflammation or mucosal injury within the reproductive tract. And finally, most seriously, if you experience unexplained fatigue or unintended weight loss, early-stage prostate cancer cannot be ruled out. Pushpin according to Cleveland Clinic, 2022. Any case of hematospermia lasting longer than 3 weeks in men over 50 should be promptly evaluated using a prostate ultrasound and PSA testing. Many men avoid seeing a doctor because they fear hearing bad news. But look at it this way. A simple medical checkup today might save you from a much more difficult treatment journey in the future. Most of the time, just a transrectal ultrasound, a PSA blood test, and a urine test are enough for doctors to accurately identify the cause. And most importantly, if everything is normal, you'll walk away with genuine peace of mind, not just self-reassurance. Brain, remember, going to the doctor isn't a sign of weakness. It's a decision that says you want to take control of your body, live longer, live healthier, and not let anything silently erode your strength as a man. If you've just discovered blood in your semen, the first thing you need to do is not panic. But immediately after that, you need to take the right actions. First, stop excessive masturbation or using improper positions. Many men tend to masturbate while sitting for long periods, bending forward, or unconsciously clenching the pelvic muscles too tightly. These positions can easily rupture microcapillaries and put unnecessary pressure on the prostate and seminal vesicles. Taking a break for a few days allows your body time to recover and gives you a clearer picture of what's actually happening. Second, make it a habit to urinate after ejaculation. This simple step is extremely important as it helps flush out any bacteria or residual fluid from the posterior urethra, the section directly connected to the prostate and seminal vesicles. In cases of mild asymptomatic inflammation, this small action can significantly reduce the risk of infection. Third, observe your semen at least 3 times within 2 weeks. Pay attention to its color, consistency, smell, and whether there is any visible blood. This practice not only helps you determine if the condition is improving or worsening, but also provides valuable information if you later need to consult a specialist. One thing you must not do is self-medicate, especially with antibiotics. Many people believe they're handling it well, but in reality, they may be masking symptoms, which makes future diagnosis more difficult and risks missing the real underlying cause. And finally, if the issue recurs, see a urologist immediately. Your doctor may recommend tests such as PSA, prostate-specific antigen, prostate ultrasound, semen analysis, or even transrectal endoscopy if needed. These tools are essential not only for detecting inflammation, cysts, or benign enlargement, but also for ruling out early-stage prostate cancer. You may have been strong and steady for decades, but after 50, the body begins to change. Quietly, without warning. And in that silence, the prostate may be the first place to make you feel like you're weakening, in a way you can't quite explain. Blood in your semen is not as frightening as your silence. Masturbation isn't wrong, but if you do it incorrectly, too often, or ignore the signals your body sends, the price you pay could be painfully clear. Red triangle pointed down, persistent fatigue. Red triangle pointed down, poor sleep. Red triangle pointed down, declining sexual function, and ultimately, the silent erosion of your masculine confidence. Direct hit. If this video has helped you better understand your body, hit like, share it with someone you care about, and leave a comment if you've ever been through something similar. I read every single one, because men's health deserves real attention. Backhand index pointing, right? And in the next video, what topic would you like me to cover? Leave it in the comments, we'll talk about it, like men who respect and understand our bodies. I'm Alice, and I'll see you again on Men Health 30, where we don't shy away from the truth. Because you deserve to live strong, live clearly, even after 50.